All right, welcome to this video. In this class, we'll be going through your overall wellness program. So these are some of the things that you can do in addition to the back pain specific recommendations that we've made thus far. And by the end of this module, we're really hoping that you will have developed your own wellness program, your own program for staying healthy. The healthier you are, the less likely you are to experience pain. There's definitely a metabolic and stress connection to pain. So by following these recommendations, we can help you to either not have a recurrence of your pain, to prevent pain down the future, or to ensure that you continue to live your best life and do the things that you most enjoy. So the goal of this class is to help you with sleep, give you some ideas on nutrition, give you some breathing exercises to use for stress management, help you with a lifestyle audit so you optimize your environment, and look at some supplements and other therapies that can help with recovery, and basically just to support your own ecosystem. So none of us are alone in this. We're surrounded by all these different inputs, whether they're other people or our environment or our work or our nutrition or our sleep. And so all of them create this ecosystem, and we want that ecosystem to be as healthy as possible. Thus, all these different recommendations to make that a reality. So let's start with your recovery foundation. You know, if you're taking the course, you're probably already doing a fair amount of movement and activity. Most of us are deconditioned. We don't do enough activity in our daily lives. And so increasing the amount of activity that you do daily is really important. And I'm using the word activity here because some people think it's, exercise. You have to go to the gym or this or that. And that's not entirely true. It's just important that you stay moving, moving an adequate amount every day. So here, 30 minutes of cardio every day. This can be accomplished if you're doing a 5-minute stroll, throughout your day. If you find yourself slouching, overcorrect your posture, get back to that normal, neutral posture. And all of these things are helping to improve blood flow. They're helping to get the blood flow into the tissues, supporting those tissues. They're supporting your body's own natural pharmacy and releasing these things called endorphins, which are basically the body's own painkillers. And a movement helps your tissue pliability. So it helps your tissues be soft and supple and movable and adaptable. And all of these things are extremely helpful in terms of your long-term success and long-term health and wellness. So here are some ideas in terms of your sleep. So no screens, at least 60 minutes before bed. Screen time can really increase your latency, so increase the amount of time that it takes you to fall asleep. Sleep at least 7 hours with an efficiency of 85%. So for most people, that means in bed for 8 or 8.5 hours to get the full 7 hours of sleep, because the amount of time that you're in bed is different than the actual amount of time you're sleeping. You want to ensure that your environment is cool. Here we're recommending 15 to 19 degrees Celsius, so around 60 degrees Fahrenheit. Use blackout curtains so there's no ambient light. Make sure that your environment is quiet, or use a white noise machine if that works better for you. And then once you wake up, you can do some diaphragmatic breathing, get into your body. And in order to fall asleep easily, it's best to avoid caffeine in the afternoon and limit alcohol. Alcohol can affect your REM sleep and your deep sleep, and the caffeine can affect that latency and make it harder for you to fall asleep. So here's some suggestions on mastering your diet. It really depends on where your diet is, whether or not these will be appropriate for you. We do have another course that goes more into depth with diet, if that's something that you know that you need some help with. But these are some very kind of general recommendations. Make sure you're eating lots of vegetables, you're eating clean protein, clean carbs, and a fair amount of fats. And then if you need additional support, consider taking supplements such as curcumin, which is the active ingredient in turmeric, omega-3s, high quality omega-3s, and antioxidants, and different spices can also be high in antioxidants and help with inflammation. And make sure that you're drinking plenty of water, starting your day with a 16 to 20 ounce cup of water. You can put lemon in there if that's what you'd like. Trying to sip the water as frequently as possible, and making sure that your urine is either clear or pale yellow. That ensures that you're adequately hydrated throughout the day. So your gut plays a crucial role in pain. There is definitely a metabolic component to pain. And so ensuring that your gut is as strong as it can possibly be by following these dietary recommendations is very important. So, inflammation is mediated by the immune system. 70% of our immune system is found in the gut. And so anytime there's gut inflammation, there is the possibility of systemic inflammation, which is going to make the pain much worse. And so we want to ensure that we're taking the time to adequately address our gut health, as well as the pain that we're experiencing, by supporting the microbiome, and possibly by eating some fermented foods that are high in probiotics, and ensuring that you're eating a high fiber diet. All those vegetables that we mentioned, the tricolor vegetables that we mentioned earlier, are all going to help with the prebiotics. Do your best to avoid artificial sweeteners, antibiotics unless they're absolutely necessary, excess alcohol, and chronic stress. All of those are going to affect your gut, and so you want to avoid those whenever possible. So let's look at some breathing exercises that you can do that will be helpful during this program. We have the 4-7-8 breathing. This is relatively difficult. I probably wouldn't start with this one. Basically, you inhale for 4, you hold for 7, and you exhale for 8. And repeat. And I'd recommend starting with about 5 rounds of that. An easy one that's great for everybody is the diaphragmatic breathing. So you take a deep breath into your belly and exhale from your belly, really using your diaphragm as you breathe. Then we go into the box breathing. So this is done on a count of 4. So you're going to breathe in for a count of 4, hold for a count of 4, exhale for a count of 4, hold for a count of 4, inhale for a count of 4, and then you just continue in that vein, doing about 5 sets of that. Coherent breathing is inhale and exhale about 6 seconds long, inhaling for 6 seconds, exhaling for 6 seconds, just creating this coherence in your breathing. Nadi Shodhana is another relatively challenging one. Basically, you're going to use a couple of your fingers to close your nostrils, and you're going to inhale through one nostril, you're going to close, you're going to exhale through the opposite nostril, then you're going to inhale through that nostril, close, and exhale through the opposite nostril. Inhale, close, exhale, and just continuing back and forth like that. Again, 5 rounds is really a good place to start with all of these. So here's an environmental audit that you can do for yourself, just to see where you're at and where you might need some more additional support. So on phase 1, you're basically doing your audit for your sleep environment. What needs to change in your sleep environment for you to sleep better? You also want to look at the ergonomics at your work environment. Is there anything that you can improve in your work environment in order to make it more effective and to support your overall health and wellness? And then phase 2, week 2, if you're notice how your pain is related to the different activities that you're doing, your stress, your sleep. Notice if there's any correlations there that you can, any patterns there that you can identify. And then phase 3 is this systemic optimization. So you're just basically changing one variable at a time. So the thing that most people run into is they try and do too much too fast. So you just want to make one change and have it stick, as opposed to making 10 changes and having none of them stick. So pick one thing that you want to change and then work very diligently to change that one thing. And then go on to the next one. And sometimes the things won't stick, and that's totally fine. Just go on to the next one until you find one that does stick, that's easy for you to do. Don't beat yourself up about it. There's plenty of room for changes to be made. So just do what you can do. So here are some additional recommendations that you can utilize if you're not getting the results that you would like. I mentioned this earlier, curcumin, it's in turmeric. That's a strong anti-inflammatory that can help with pain. I also really like quercetin. Quercetin is a strong anti-inflammatory. I find that to be really helpful. Devil's claw is another herb that's used for pain relief, and boswellia is another herb that's used for pain relief. All of these can be really helpful to support you to manage your pain and get rid of your pain. You could also do some contrast therapy. I like to do this in the shower. Some people have a cold plunge. Cold plunges are really popular right now. Basically, you would, take your shower in warm water, and then you do 1 minute of cold. I think 4 to 6 cycles is a lot. I only do about 3 cycles. But yeah, the more cycles you do, the more effect you're going to get. So that may be helpful. And then you want to end with cold. And so, if you have circulatory issues, if your body doesn't respond well to cold water, then please don't do this. All these recommendations are not for everybody. I'm just giving you kind of a menu of different options that you can utilize to get the best results with this program. So there's some accountability strategies that you can utilize as well here, whether that's check-ins with an accountability partner or some sort of habit tracking app that you're utilizing to track these different habits. And then as you go over time, you might want to adapt. You're going to need to adapt these changes. They'll become habitual, they'll become kind of rote. And then you might want to adapt them. And in order to keep that novelty, the brain really likes novelty. It's great to be part of a community that's supporting healthy habits. Maybe that's a supper club, or maybe that's a workout class, whatever it is. And then, continuously moving towards growth. Constantly assessing, reassessing, finding ways that you can keep growing and learning and keep implementing more of these wellness strategies and routines. So that was just a little smorgasbord here of some of your options in terms of this approach here. I hope that you found that to be helpful, and I hope that you're able to incorporate some of these strategies into your daily life. Thanks so much for watching.